Welcome, Team MoreCare. It's March 25th, day 2 of Governor Edwards' shelter-in-place order. And I'm proud to report to you that MoreCare is continuing to operate as normal. I am socially distanced here in the office. I'm here by myself. Fortunately, we've designed our systems to work in a cloud environment so that all of our team can work remotely. So our payroll system, our scheduling system, our phone system, all these things operate in the cloud. In the event that we were to have a hurricane, and who could have ever seen that we would have a pandemic where we all needed to work remotely? But that's what we've got, and fortunately our systems do work in that environment. Also, it's fortunate for us that our industry is declared as one of those that can continue to operate because it's required that we take care of the folks that we take care of. They need us. So thank you for continuing to do that work. We're very fortunate that we work in an industry that is continuing. There's many people, restaurant industry, retail industry, even a lot of doctors' offices that aren't able to go to work right now. And that's a bad situation for the economy as a whole, and certainly for those individuals. So thankfully, we're able to continue to work. It's very important that you stay healthy so that you can continue to work. And so I will ask that you please try to avoid public spaces, Walmart, places such as that, where you have a much greater risk of coming into contact with someone that has the COVID-19 virus. If you do go into a Walmart or a grocery store, do the best you can to socially distance. I know when I go to the store now, and I try not to do it, but when I do, I look strange, awkward, because I am really walking around people and it feels weird, but I don't care because I do not want to be exposed to this virus. When I touch a keypad to enter in my PIN as I'm paying or whatever, I'm also very aware of the fact that someone that came before me might have been exposed to it, might have had that. So as soon as I leave that public space, I immediately get some hand sanitizer and clean my hands. And as soon as I get home, I'm washing my hands. So I recommend that you follow that same procedure. But the best thing you can do is avoid those public spaces. Go to your shift, go home. Try to stay out of the environment where there's a lot of people and you could, be exposed to it. Fortunately, you work in healthcare. You're at the front lines of providing healthcare services, but fortunately, you do work in a somewhat isolated environment when you're in a client's home, someone who probably doesn't leave home that often, and so you're much less exposed to the risk there, and that's a good thing for all of us. A good thing for you to stay healthy and for the client to stay healthy. So let's protect that environment by not contracting something that you might drag in there. So be very, very aware of that. Also, a few reminders: when you do start your shift, the very first thing you want to do when you get there is to wash your hands. Wash them good. Second thing you're going to want to do, and this is all in the app, it should be in your, if you're using the app, it's in your checklist of things to do, but it's to check your own temperature. And the third thing is to check the client temperature. If the client refuses or doesn't want to do it, that's okay. We're not going to make them do it, but certainly try to keep tabs on how they're doing. And if you feel like they have a fever, then you need to report that to the office. And certainly, if either of you tested or pulled a temp above 99.5, then you're going to want to call the office and let us know about that, and we'll come up with an action plan on that. If you do these things, if you keep yourself healthy, you follow those 3 steps of washing your hands, taking your temperature, taking the client temperature. Oh, and also, anytime you're within 6 feet of the client, these days we're asking you to wear a face mask. We've just got a new shipment of face masks in. If you don't have any, please email the office, call the office, and we'll get you some. I want you to use those when you're within 6 feet of the client. So if you're helping them walk or if you're getting them dressed or whatever, wear the face mask. If you're sitting across the room on the sofa and then you can take it off for a little bit, that's fine. But anytime you're in close proximity, let's do that. Who knows if when you were in Walmart yesterday, you came in contact with someone, and we don't want you to be exhaling that directly onto a client. So it's just an abundance of caution. And not only that, it's going to make them feel a little bit safer just because you appear to be protecting yourself. It's as much about, giving the appearance of it's not just an appearance. Of course, we're trying to do everything that we can to protect our clients. So be aware of that. So outside of those reminders, the other thing that I wanted to talk to you about today is to let you know that we recently had an inspection by Louisiana Department of Health and Hospitals. And I'm proud to report that our team did an exceptional job and got zero discrepancies on that inspection, which is just phenomenal. That's just not heard of. And so Miss Janice Thomas, who led the charge on pulling everything together for this inspection, Miss Ruthie Johnson, Miss Kendra Garner, and Mr. Jamal Kane, the four of the, and Miss Marion Freeman, the five of them working together to pull the files together, all of you providing good care notes for us, and the team in the office pulling together the policies and procedures on every aspect of our business, came together beautifully, and they just did a wonderful job of making this happen. And then not only that, when the DHH inspection team was here, just having it ready, I mean, anything they asked for, we had it ready within seconds of the request. So they just did a bang-up job of passing that inspection. Kudos to them for doing what they do every day and do a good job of it. But man, passing that inspection like that was just huge, just like 100% score. So we should all be very proud of that. And I know the team here in the office is all very proud of each one of you out in the field. We get compliments quite often regarding the level of care that you provide to our seniors and the developmentally disabled out there in the community. And it's a service, it's God's work, and thank you for doing it. You should be very proud and filled with purpose for what you do every day. Not everybody has a job that provides the level of purpose that your job can provide. There's three different primary areas in my mind where we provide service. One is those of you that are working on the Medicaid side and working with a developmentally disabled person. What you do to empower that person's life so that they can live as normal a life as possible is enormous. That is such a wonderful service that you provide to that person. And then there's those of you that are working in a senior's home, and whether it's helping them get to a doctor's appointment, helping them get dressed, remind them to take their medications, you are providing a service that, number one, keeps them out of a nursing home, keeps them out of an assisted living facility, and in a comfortable environment that they know and love, which is their home, where they raise their kids, where they had their grandkids, they had their Thanksgiving dinners, or whatever the case may be. They are comfortable there, and you providing services to them that enables them to maintain that level of dignity of staying in their home is huge. It's huge. So thank you for doing that work day in and day out. And then third, and this doesn't happen as often, but sometimes we have the opportunity to provide end-of-life care to a family. So if a senior has gotten to a place where they really need 24-hour care, they're very sick and within weeks of passing away, our services can just be monumental in helping that family deal with that grief, the tragedy that they know is looming, but us being able to be there and provide extra support, love and support, and services so that it frees them up to spend quality time with that family member. And I knew that was a valuable service that we provide to families, but I didn't really know it until I experienced it. About 2 months ago, my father was at end of life, and the service that MoreCare provided to my sisters and my mother and myself as we grieved the pending loss of my father and spent those final days with him was invaluable. And we were so very grateful for the caregivers. Miss Ime Ibere and Miss Joanne Johnson were the two that, Joanne Morrison, I'm sorry, Miss Joanne, were just instrumental in providing love and support. And to this day, they stay in touch with my mother, and they're just the sweetest ladies. So thank you all for doing that type of work day in and day out. And just know that it's so appreciated by the families that you provide care to. So thanks again. Thanks to the office staff for doing the quality work that they do, such that we got 100% from DHH. Good Lord, that's enormous. But what's most important is those compliments that we get from families out in the field when you folks do the loving quality work that I call God's work, because that's what it is, and you should be so filled with purpose every day doing the type of work that you do. So thank you for that. The MoreCare team really appreciates it. I know I do. And until next time, stay healthy. I don't know if I'm going to do another one of these videos or not. This is a bit of an experiment, but I just wanted to try to connect with you during this very odd pandemic time, but express to you my gratitude for each one of you and for the fact that our business is able to continue to operate in this environment. Thank God for that. And so stay healthy, stay safe, and I'll see you hopefully on the ending pandemic very soon. Hopefully, life will return to normal. So thanks again for what you do for MoreCare.